We're here today to provide you with a detailed update on the COVID-19 pandemic. Friday, I joined the nation's governors on a teleconference with members of the White House Coronavirus Task Force to discuss national COVID-19 response and recovery efforts, as well as vaccine development and distribution planning. Earlier this week, I convened another meeting of Maryland's Coronavirus Task Force, and earlier today, I received a thorough briefing from my Unified Command Task Force and held a meeting with the presiding officers of the Maryland General Assembly to discuss the state's COVID-19 situation. Following our fact-based and data-driven approach, and in collaboration with our team of experts, we continue to closely monitor all of the public health metrics in Maryland, as well as the spiking numbers in states across the country. As of this morning, Maryland has had 149,964 confirmed cases of COVID-19, including an additional 1,198 new cases over the past 24 hours. Which is our highest one-day total since July 25th. 588 Marylanders are currently hospitalized. A total of 17,435 Marylanders with COVID-19 have been hospitalized to date, and 4,035 Marylanders have lost their life to this deadly virus. There were more than 100,000 cases just yesterday in the U.S., the nation's largest one-day total ever. And the virus has taken 233,777 American lives and killed over 1.2 million people around the world. New shutdowns are taking effect all across Europe and in many states with numbers spiking out of control. The indisputable fact is that we are now in the midst of a major surge of COVID-19 in America. This was predicted by the experts at the height of the pandemic back in the spring, and it is something that Maryland has been preparing for the past 8 months. In many states across the country, hospitals are reaching their capacity. There is a troubling nationwide shortage of nurses, and in many places, PPE is once again in short supply. The good news is that Maryland is continuing to do better than most other states on our key health metrics and on our economic recovery. Our positivity rate is lower than 42 other states. Today, our 7-day positivity rate statewide reached 4.21%, and we have been under 5%, the benchmark set by the World Health Organization and the CDC for 133 consecutive days since June 25th. Unfortunately, our positivity rate has begun to trend in the wrong direction, and we now have 7 jurisdictions in our state with positivity rates which have gone above that 5%, including Allegheny, Dorchester, Garrett, Harford, and Prince George's, Queen Anne's, and Somerset. Current hospitalizations are down nearly 66% since they peaked 189 days ago at 1,711, and ICU levels are down 74% since their peak back in May. But over the past 2 weeks, we have seen a concerning increase in hospitalizations and in ICU levels. The bulk of the new cases are among young people, while a majority of our hospitalizations are still trending older. We're concerned that we are seeing a slow but steady increase in the number of cases per 100,000. And while we remain out of the red zone designated by the federal government for our positivity rate, Maryland just entered the red zone for cases. Our average cases per 100,000 has risen to 15 which is a 22% increase in just the past week. And case rates are now above 10 cases per 100,000 in 18 of our 24 jurisdictions. Harford County's case rate average increased by 82% over the past week. Baltimore County is up 41%, and Carroll County has risen by 36%. Our statewide case rate of 15 is, however, still much lower than 40 other states, including North Dakota, where the average is 171.9 cases, South Dakota, which is at 131.2, Wyoming at 86.8 cases per 100,000, and Wisconsin, which is at 82.4 cases per 100,000. Our statewide metrics do not yet warrant taking drastic, immediate actions. However, the upticks in some of our metrics here and the spiking numbers in other states do place us once again at a pivotal moment in this fight. The good news is that Maryland has been preparing for this fall surge since the very beginning of the crisis. We're in a much better place than we were at the beginning of this pandemic. We took some of the earliest and most aggressive actions in the nation to slow the spread and to flatten the curve. We reopened closed hospital facilities and stood up field hospitals in order to increase our surge capacity by an additional 6,000 hospital beds. We met and exceeded that goal, as well as our goals for ICU beds and ventilators. We know a lot more about how to treat patients with the virus in order to keep them alive. Life-saving therapeutics such as remdesivir are more readily available. Our hospitalization stays are generally shorter, less severe, and with better outcomes. We have built a robust contact tracing operation, nearly 1,400 tracers strong, to find patterns and identify where and how the virus is spreading. We built up an entire COVID response infrastructure from scratch, including a successful long-term testing strategy and a strategic stockpile of test kits and supplies. In March, we had the ability to conduct just 50 tests per day. As of today, Maryland has conducted over 3.5 million COVID-19 tests. We now have over 220 testing sites available across the state and have recently deployed new rapid 15-minute antigen tests to all our nursing homes across the state. Our aggressive testing strategy has enabled us to detect more cases and to isolate outbreaks, and we're continuing to do more each and every day. In response to a growing increase in infections in Allegheny County, just today, in consultation with county leaders and in partnership with the county health department, we are standing up a brand new testing site at the Allegheny County Fairgrounds. We have spent months ramping up our stockpile of PPE, distributing more than 78 million units to date, and we have built up a 60-day emergency supply of the most critical resources. As we speak, nearly 40 Maryland companies are working to develop and manufacture COVID-19 vaccines, innovative therapeutics, including Novavax, which is adding another 400 jobs here in Maryland and was awarded $1.6 billion through Operation Warp Speed to complete late-stage clinical development and to establish large-scale manufacturing in order to deliver 100 million vaccine doses as early as late this year or early next year. And after months of advanced planning, the Maryland Department of Health submitted a plan to the CDC for ordering, distributing, and administering a vaccine just as soon as it becomes available. With the shortage in nurses that we're seeing in other states, today we are renewing our earlier efforts to increase the number of healthcare professionals in Maryland. This spring, I issued an executive order to fast-track the licensing process to allow for out-of-state healthcare practitioners and those with an expired medical license to be able to assist, and an executive order to provide more authority to designate emergency medical technicians and paramedics with a special provisional status in order to work in Maryland clinics and field hospitals. We also activated the Maryland Medical Reserve Corps, a force of dedicated and trained medical and healthcare professionals ready to assist in a public health emergency. And I directed the Department of Health to immediately institute a program to allow medical students, nursing students, and medical technician students from our universities and colleges and community colleges to be able to assist and be part of this medical relief effort. More than 15,000 people signed up to be a part of this initiative from every single jurisdiction throughout the state. Today, we are once again asking for more help. To sign up, please go to mdresponds.health.maryland.gov. We just doubled our investment with an additional $250 million for the Maryland Strong Economic Recovery Initiative to provide even more help to our struggling families and small businesses. And we have asked counties to match these new state investments by utilizing their remaining CARES Act funding, which must be spent by year's end. I have continued to strongly urge our leaders in Washington on both sides of the aisle to finally provide desperately needed additional federal funding for our health and economic recovery efforts, for our small businesses, struggling families, and our state and local governments. And I've called on leaders in Congress on both sides of the aisle and the members of our Maryland delegation to put the politics aside in order to reach common sense compromise and to finally get this done for the American people. Thanks to the heroic efforts of so many state employees working around the clock, and because of the vigilance and support of the people of Maryland, we are much better positioned than we were this spring, and Maryland is much better prepared than most states to be able to withstand this next surge. However, I cannot stress strongly enough that we cannot afford to let our guard down. The warning lights are starting to flash on the dashboard, and nobody should think for 1 minute that we are somehow immune to the spikes that we are seeing spread in surrounding states in the region and across the country. The weeks and months ahead will be difficult, and our collective actions will determine whether we can continue safely on this road to recovery. From day one of the pandemic, I have never hesitated to take the actions I believed were necessary to guide the state through these twin health and economic crises, and we will continue to do so. But today I'm calling on the people of Maryland to once again do your part right now to help us keep this virus at bay. Our ability to weather this storm effectively, to keep everyone safe, and to keep Maryland open for business will absolutely depend on the actions each of us takes in the days and the weeks ahead. We should not and we cannot become complacent. We've come too far together to ignore the warnings and to have out-of-control spikes like so much of the country. Today, we need every single Marylander to recommit to the actions that have helped us crush the curve the first time around. The simple steps that can help us keep our loved ones and neighbors safe. Our statewide masking order will remain in full force and effect, requiring everyone to wear masks or face coverings in the public spaces of all businesses across the state and at outdoor public areas when it is not possible to maintain physical distancing. Wearing masks continues to be the single best mitigation strategy we have to fight this virus. It is the best way to keep you and your family members safe, to keep people out of the hospital, save lives, and to keep Maryland open for business. I mean, it's that simple. It's not that hard. Just wear the damn masks. We're concerned about increasing recent reports of individuals and businesses becoming more lax and not following the law. We're also concerned with the lack of compliance enforcement by our local partners. I also want to say this as strongly as I can. Local leaders, county health departments, county liquor boards, and when necessary, local law enforcement agencies must immediately step up their efforts to the levels they were back in the spring to ensure that all businesses in their individual jurisdictions are in compliance with all public health regulations. Maryland statute gives counties the power to implement more restrictive policies based on the conditions in their individual jurisdictions. Counties with high positivity and case rates will have my full support as they continue to make some difficult decisions at the county level. We encourage people who can telework to do so, and employers should make every effort to give employees the opportunity to telework. We remind you to always avoid crowds, to continue practicing physical distancing, and to frequently wash your hands. Today we are renewing our travel advisory, warning Marylanders to avoid traveling to states that are experiencing spiking virus numbers. That includes any travel to or from states with positivity rates of 10% or higher. We strongly advise you to cancel or postpone any travel to those areas until positivity rates decline. If you do travel to one of these locations, you should immediately be tested for COVID-19 and should self-quarantine while awaiting the results. With the holidays approaching and so many Marylanders making plans to spend time with families and friends, it is more important than ever for all of us to remain cautious and vigilant. I know from personal experience that there's a false sense of security when we spend time with our family or friends, especially at home, and we feel safe. We tend to let our guard down. But our contact tracing operation continues to show that family gatherings, social gatherings, are the most likely source of transmission. The number one activity of those who have become infected that shows up on our contact tracing continues to be family gatherings, followed by house parties. 56% of all the interviewed cases that have contracted the virus in the past 2 weeks said they had traveled outside of Maryland. They worked outside the home, attended a gathering with at least 10 people, or visited a high-risk location. We shouldn't lose sight of the obligation that we have to protect the health of the most vulnerable among us, especially grandparents, older relatives, and those with underlying conditions. We want all Marylanders to enjoy the holiday season with their loved ones, but we want you to do so as safely as possible. I understand that there is a very real COVID fatigue, and it's extremely frustrating to all of us that things are still not back to normal. We had all hoped that this crisis would be behind us by now, but the simple fact is it is not. The straight truth is that this virus will be with us well into next year, and that in fact our worst time may be over the next couple of months. This very long, very difficult time has taken an unimaginable toll on our families, our businesses and communities, and on each and every single one of us. But I want the people of Maryland to know that we will get through this together and that we will come out of this stronger and better than ever before. I remain committed to telling it to you straight and to keeping the people of Maryland informed with the facts. We're going to continue to respond quickly and decisively to any changes in the situation as it develops. And we are going to continue to attack this virus with every tool at our disposal. And the most effective tool we have is each and every one of you, the people of Maryland. With that, at this time, I want to turn the podium over to Dr. David Marcosi, who, as I said, is the COVID-19 Incident Commander for the University of Maryland Medical System, and he serves on our Coronavirus Task Force. Doctor?
Thanks. Good afternoon. Governor Hogan, thank you for your leadership through this crisis and the opportunity to speak today around the efforts to keep Marylanders healthy and our state open for business. In looking at the state's public health data, it is obvious that Marylanders have fought back against this virus. As a result, we were able to take measured steps to reopen the state. The reality, though, is that we are entering a period of high risk these next few months as the virus spreads more easily when we gather indoors together. In fact, recent Maryland data is concerning as there has been a noticeable increase in our state's positivity rate and the number of COVID-19 hospitalizations, which means more of us have this virus. More of us are spreading this virus, and more of us are becoming sick as a result of this virus. Hospitals, staffed with nurses, respiratory therapists, doctors, environmental service professionals, and social workers, are working hard across the state to continue to provide acute care in their hospitals to treat not only routine medical and surgical conditions, but also the increasing numbers of COVID-19 patients. They are all heroes, and we can help them. Outside the hospital, know that it is safe to go to your doctor's office for routine care and preventive screening. In fact, many offices are now even offering that care through telehealth or by phone call. Please get your prescriptions filled to keep yourself healthy so that any chronic conditions you might have don't worsen. I think we also need to recognize that this virus doesn't just affect us physically. It affects us mentally. This has hit me personally, as I've lost a friend to suicide. In this pandemic. Let's make sure we stay connected. Let's make sure we reach out. Let's make sure we support each other and talk to a professional if helpful. Excuse me. We need to make the right decisions to continue to prevent the spread of this virus today and for the next few months, or we could lose the positive impact we have all worked so hard to achieve. The upcoming holidays will be an especially challenging time. Consistent with CDC guidance, please weigh these factors when considering planning any in-person gathering. The number of people, the smaller, the better. The locations attendees are traveling from. Don't include vulnerable individuals. Ask and be aware of the behaviors before and during this event so that you can keep them and yourselves safe. It is a predictable surprise. If we don't protect ourselves and each other, we will face significant health and economic challenges these next few months. I'm tired of COVID-19. I think we're all tired of COVID-19. But the virus isn't tired. It is waiting. That is our reality. And these next few months will require us to double our efforts and stay the course. In the end, what does that mean? Wear a mask over your mouth and nose. Don't pull it down to speak. Only touch the sides of your mask, not the front, when you need to adjust it. Keep yourself physically distant from each other. Keep hands and high-touch areas clean. Get a flu shot, as the flu is preventable. Telework if you can. Get the COVID-19 vaccine once it is available. This may get worse before it gets better. And we are all in this together. Don't regret a decision today that negatively impacts someone you love tomorrow. Thank you.
Thank you, Doctor. With that, we'd be happy to take a few questions.
You heard the talk that the pandemic was going to be over after Election Day. Is it that talk that kind of made us drop our guard?
Well, I'm not sure if it was just that talk. There's been a lot of talk for many months, and people not taking it seriously. I mean, I heard it was going to magically disappear the day after the election. I can tell you, people that said that were dead wrong. We were told it was going to take 14 days to flatten the curve. We were told it was all going to soon disappear. We were told it was going to be gone by Easter and then by July. The fact is we're still in this crisis. We're probably at a worse point than we've ever been, and it's growing, as Dr. Marcosi said, silently all across the country and around the world again. And so, there's a lot of disinformation and misinformation and people that aren't taking it seriously. I think what we're seeing here in Maryland, we took it more seriously than most people. I mean, there was recent polling, 89% of the people were following the advice and liked the steps that we were taking. That's better than almost any state in the country. And people were listening. And they were doing the things to keep them safe. I think what happened is people just felt, they're fatigued. They're tired of doing it. And they felt comfortable because our numbers were so good. And we were doing so well. They're like, it's not that big of a deal. But as you see, I talk to my fellow governors that are calling me, talking about patients stacked in the hallways and increasing deaths and running out of hospital beds and not having nursing staff. It's comes real to you. And as we see our numbers start to go, we don't want to be one of those states. And we've all said over and over again, the simple things that we've all done have worked really well. We just have to get back to them. And we have to take it seriously again.
Governor, you said
Jumped right in there, Phil.
The metrics don't mean that you'll take drastic actions. What are you specifically looking for? Is it the positivity rate? Is it hospitalizations? Is it all of those? What number should Marylanders be looking at that says the governor may take actions if we reach this number?
Well, so it really is looking at all of the and those are just 3 or 4 of the metrics, and we're looking at lots of data points. Really smart folks every day in our State Department, Maryland MDH, Department of Health, our local health officers, all the people in our coronavirus recovery team, our people in our office. We're watching everything, and it's really a combination of all that. And some of it is not this exact number, or if this happens or that happens. It's a judgment call based on the best advice from the smartest people we can find about what's happening. So it's not if these are a couple of blinking lights that we don't like. We have some encouraging signs, as I said, compared to other places, but we're going to watch every number. The most concerning one is the hospitalizations. We don't want to have our hospitals overflow again.
Governor, schools. We talked, I mentioned schools. You'd like to get kids back in school. Those most at risk and those most at risk. Some counties are, some counties aren't. Prince George's is going to reassess in February. University of Maryland a few moments ago said they're going all virtual after Thanksgiving. What do you think now about the schools? Is it time to pull back on that? Some have in the region, not necessarily the state.
Well,
Service County is looking at February.
we all still feel, and I think maybe Dr. Chan today, and Dr. Salmon, I think, had a meeting and a discussion with some of the local counties and health departments and superintendents of schools, and we're talking about continuing guidance and having those discussions with them. Those duly elected school boards, make those decisions based on their best judgment on the ground in their jurisdictions. Nobody was really pushing to fill the schools with people, but there are some special populations that just can't do the distance learning, and that they really were trying to get the kids who needed it most in small numbers safely back into schools, and I think many of the school systems will continue to be able to do that. But, nobody's looking to fill the schools back up with the virus as spread around as it is.